Let's talk about ketamine and jump into a bit of its history. Ketamine is called a dissociative anesthetic, which means it may cause someone to lose awareness and not experience their senses in their typical way that they would. And it can cause someone to lose consciousness. It can also cause people to feel disconnected from themselves, disconnected from others, and disconnected from reality overall. And ketamine's birth story actually starts with another drug called phencyclidine, otherwise called PCP. As PCP and ketamine are both anesthetics, it may be useful to jump into just a little bit of the history of anesthetics. So throughout human history, a bunch of different concoctions were made to try to cause someone to lose consciousness, especially as they were preparing to undergo some sort of medical procedure, for example. And so some of these concoctions included alcohol or opium, but they were often unreliable, and in some instances, they caused death. And so if you had to undergo some sort of medical procedure and you were completely conscious, you'll be experiencing excruciating pain. And just as a quick aside and a quick shout out, if you're ever in Chicago, please visit the International Museum of Surgical Science. So many exhibits that jump into the history of surgery. Now to jump back into the history of anesthesia as it relates to this talk. So Dr. Hanoka in Japan in 1804 was the first to use a general anesthetic, and this was actually for a mastectomy. Then another quick historical tidbit, in 1846, Dr. Morton in the United States used an anesthetic for dental surgery. Then phencyclidine, or PCP, is actually ketamine's parent, which was discovered by Dr. Maddox in 1956 to use as an anesthetic for animals. Then in 1958, research with PCP in humans was initiated. Fast forward to 1963, PCP was then able to be used for clinical purposes in humans. Soon thereafter, they were noticing all these crazy side effects where people would be dosed with the anesthetic, but be experiencing these crazy side effects and symptoms long after they had been dosed. These side effects include experiencing psychotic symptoms and being excited for hours after they had been dosed with PCP. With these side effects emerging, clinical use of PCP in humans was just not allowed. But the question became, is there some sort of short-acting anesthetic that can be derived from PCP? Essentially, can we have some sort of short-acting anesthetic that doesn't have these intense side effects that are seen in PCP? Substances were derived from PCP. One of these drugs that was derived from PCP is ketamine, which at the time was called CI 581. Dr. Domino was actually the first person to use ketamine in humans. During this clinical trial that was held at a correctional facility, I believe, during that clinical trial, folks were saying that they felt disconnected from their body. Dr. Domino described these symptoms to his wife, Tony. And Tony is actually the person who coined the phrase dissociative anesthetic. Talk about relationship goals, right? He came home telling his wife about his day at work. She then comes up with a phrase. That phrase he then puts into the academic and the medical history essentially forever. Like, he immortalized the phrase that his wife came up with when he came home to tell her about his day at work. Most people buy flowers or chocolates or bears for their significant other. He immortalized her in the academic and medical literature. Let's see someone on the Love is Blind top that. Okay, jumping off relationship goals. Then in 1970, ketamine was available for human anesthesia, and it had usage in the Vietnam War. Then in 1999, ketamine became illegal as a Schedule III drug in the United States. Then in the 1990s and the 2000s, those pesky researchers were finding that ketamine was having some sort of effect on the mental health symptoms that folks were experiencing, especially as it relates to symptoms related to depression. Then in 2019, esketamine, which is a derivative of ketamine, received FDA approval for treatment-resistant depression, and it's a nasal spray. Other research has identified ketamine as being effective in reducing symptoms related to thoughts of self-harm, and then also symptoms related to PTSD, and also bipolar disorder. There's also a type of treatment called ketamine infusion therapy. With ketamine infusion therapy, the gold standard would be to also receive psychotherapy alongside it. And that's called CAP, K-A-P, ketamine-assisted psychotherapy. Not CAP as in lion, but CAP as in ketamine-assisted psychotherapy. And as with all substances, the problematic use of ketamine can result in someone developing a substance-related and addictive disorder, with one example being a hallucinogen use disorder. And ketamine was actually one of the substances highlighted as being involved in the passing of the late Matthew Perry. And in one of my future videos, I actually plan to go through the book that he wrote. It's called Friends, Lovers, and the Big Terrible Thing. There were so many gems related to mental health and addiction that were mentioned in his book. And so I just want to kind of touch on this on a future video. Let me know if you would be interested in me kind of jumping into different mental health and addiction aspects that were mentioned in Matthew Perry's book. But for this video, thank you so much for watching, and I hope that you were able to learn something today. Thank you.